Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 70 new cases of COVID-19 in Windsor and Essex County. Of the 70 cases, 13 are close contacts of confirmed cases, 9 are community acquired, and 48 are still being investigated. We have had 14,304 cases since the beginning of the pandemic. 13,478 cases are now resolved and 420 people are active at this time. There are 215 preliminary or confirmed variants identified in Windsor-Essex. Currently, 104 of our active cases are variants of concern. 15 cases are currently in the hospital and 4 people are in ICU. I'm sorry to be reporting an additional death today. A man in his 80s from the community has passed away. Our community has now lost 406 people to COVID. There are currently 8 active outbreaks in Windsor and Essex County, 4 workplace outbreaks, 2 community outbreaks, and 2 school outbreaks. Now for the vaccine update, a total of 111,362 doses have been administered to Windsor and Essex County residents. 98,928 people have received at least 1 dose. And by the end of today, we will have immunized over 100,000 residents of our community with 1 dose of a COVID vaccine. Regarding our mass vaccination sites, people living in specific postal codes who are aged 50 years and older are now able to book their vaccine appointment. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca or wechu.org. You will be asked to enter your address, the municipality in which you live, Windsor, Kingsville, or Leamington, and your postal code. Postal code neighborhoods beginning with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y will be able to book. When you attend your appointment, please bring proof of address, whether it be a driver's license, current utility bill, or another current bill. Alternatively, you can call our call center at 226-773-2200 and someone will be able to help book your appointment. Select pharmacies and primary care providers will also be offering vaccines as well, and more information will be provided when it becomes available. For general inquiries regarding vaccinations, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I have a big slide deck today, so I'll just jump right into the slides. So first we'll talk about the COVID-19 cases in Windsor-Essex. Looking across the province, as we can see that the cases are continuing to increase and the trend is going into a similar trajectory at this time what we have seen with the second wave in November and December timeline. We are already reporting more than 3,000 cases a day in the province, which is a big concern for the entire province. Looking at our region specifically, we are not seeing the same kind of increase, but where we were before a week ago, we are seeing some activity, some increase in the number of cases locally as well. Comparing ourselves with the province and where we are seeing the province is obviously seeing a steep curve with the increased number of cases, whereas the region is still not seeing the same trend, which is a good sign, and hopefully we can continue on with the trend and do not go into the trajectory where the province is heading at this time. This slide captures the week-over-week incidence per 100,000 population from week 18th, that is April 27th, to our current completed week, week 13. And our most recent completed week rate is 71.6 cases per 100,000 population, which is a large increase from the last week. And just looking at the past 7 days, and that doesn't include the completed week, just the past 7 days, our rate is 72 cases per 100,000 population. So this is pretty much in line with what we have seen last week in a completed timeline. Looking at our wastewater surveillance data, which is the red line, and in the past week our numbers jumped. Part of the sudden decline 2 weeks ago can be attributed to the heavy rain that was observed in the region, and because it just collects from the wastewater. And also a disclaimer that this methodology is still in an experimental phase. It correlates very well with the case rates in the community, but this is still an experimental study, and it gives us an indication of what's happening in Windsor-Essex with where these cases are, and if it's aligning with our active cases that we see in the community. This figure looks at our tests that are completed in unique individuals by week in Windsor-Essex. So over the last few weeks, we have seen a decline in the number of tests that are being conducted. But on the flip side, we have done 312,216 tests that were completed up to April the 3rd. And for the week of April the 3rd, our person positivity was 5.5%. This has increased significantly from the last week where it was 3.8%. Just last week, we approximately conducted 5,659 tests last week. Comparing our person positivity with the rest of the province, we are pretty much close to in the middle when there are other regions that has a higher person positivity than us. And there was a time, if you recall, November, December, our person positivity was the highest in the province, and we have gone down to a relatively better spot at this time. Breaking down person positivity by age group, and what we are seeing is a huge decline in the 65 plus population. We continue to see an increase in the person positivity in the other age group, more specifically between the ages of 18 to 34, followed by the younger age group of 0 to 17. Just looking at the difference between the person positivity and the different age group that is attending the school system at this time, the highest person positivity is still with the high school age students between 14 to 17, while the rest of the school children are the person positivity is also increasing, but not at the same level as we are seeing between the ages of 14 to 17. Just looking at this, the age, school-age children epidemic curve in Windsor-Essex. So we have started to see some increase in the number of cases in our region in the school-age children, and the overall average is increasing at this time. We understand that today is the last day, and then everyone is going to the April break next week. We're hoping that this number will decline, but something that we are closely monitoring. There are many cohorts that are currently dismissed, and we'll continue to see if it has a significant impact in our school system. If there are more evidence of transmission in the school system, then we'll have to figure out a way to how do we address that. Right now, most of these cases are epi-linked with their family and with their household contacts. So that's what we are monitoring, and that's where these cases are coming from. Comparing our overall cases with the school-age cases, so we have started to see an increase in both direction, much more pronounced in the community compared to much more pronounced in the school-age children compared to the community. But again, this is all a function of the number of cases too. The number of cases in the school-age children are limited, so even a 1 or 2 point increase can show in the graph that it's increased a lot, but it's just in comparison with what kind of an increase we are seeing in both the overall population as well as school-age population. Our cumulative regional and provincial rate, again, we are still at number 3 with respect to the overall case rates that we have seen in the province, and Peel and Toronto continue to lead the province with the highest case rates in Ontario. Breaking it down further, our case rates by municipalities is, in the more recent time, starting March up until today. Majority of these cases are coming from the city of Windsor, followed by Essex, and then Tecumseh. And the rest of the municipalities are more or less closer to each other. The distribution of cases in the last 30 days, a majority of the cases still are from Windsor, and then the rest is from the other parts of the municipality. Not much difference with respect to the last 7 days. When it comes to age and sex distribution, we are starting to see some changes in terms of who is impacted, who is getting more impacted by COVID. And with the high rates of vaccination in the older population, we are seeing a significant decline in the older population with high vaccination rates. So clearly, the impact of vaccination is already showing up in terms of not seeing cases in that population age group. But on the flip side, we are seeing a significant increase in the cases in the younger population, more pronounced in the 0 to 19 age, and then followed by 20 to 29 years. So those are the two key age groups that are currently impacted by are driving our case counts with respect to COVID. And importantly, the individuals in these age group need to be more careful in following these public health measures. The exposure history as being reported to us through our case investigations, majority of the cases are still continue to come from the close contacts or household contacts. But as you can see, the red lines are indicating the community transmission. So we still have a significant community transmission where people don't have an acquisition source. Highlights the importance of being vigilant when you're out and about or when you're meeting other people. It's important to you follow the precautions because that's how you can protect yourself. And some people may have the disease without even knowing it. So the importance of following the public health measures in a community transmission when the community transmission is high is very important. From March to present, almost 1/3 of our cases are coming from household contacts, and a similar number of cases are coming from the community transmission. So that's why it's important. And then the rest is from close contacts and outbreak related. Looking at our variants of concerns, we have seen some increase in the variants of concerns in the last week. We don't have more recent data, but please keep in mind that it takes a couple of days before we get the results of testing for variants of concern. So the data may not be as accurate, and the more recent data, especially in the last 5 or 6 days, could be delayed just because of the testing that it takes to identify a variant of concern. Our percentage of daily variants of concern cases, as we can see, has gone significantly up compared to a couple of weeks before, when we had between 10 to 20% of the cases identified in the region were identified as variants of concerns, and at one point it has gone all the way up to 40 and up to 50%. And again, with caution, the last few days or the last more recent data, it is subject to change depending on the delay in the testing for variants of concern. The source of acquisition for variants of concerns is similar to what we are seeing in the community. Similar picture, 1/3 coming from household, and close to 1/3 is also coming from community acquired, which means the variants of concerns are also out in the community that needs to be, and people need to follow the precautions as to protect themselves. When it comes to COVID-19 hospitalization, comparing ourselves, our rates with the provincial hospitalization rate, what we are looking at is the province is definitely, the cases are increasing, and in our region, it is not increasing, but it's stabilized at close to 14, 15 cases a day that we are seeing in our region. When it comes to ICU utilization, similar picture. The ICU cases in the province is increasing. Ours are pretty much stabilized at this time, and the age breakdown of all these cases is very different as well. In the province, we're seeing a more younger age group as reported by the Science Advisory Table. In our region, our ICU utilization continues to be in the 60 to 69 age group. So this graph shows the data in how each of these deaths are reported in the region. And as we report sometimes many deaths in a day, but overall the actual date of death by the number is presented in this graph. This gives you a breakdown of the age group that are dying with the COVID related complications, and majority of them, 96% of these cases, are in the elderly population between the 60 years and older. Our case fatality rate compared to the province is slightly higher with respect to our overall rates, but when we're comparing our long-term care home case fatality rate, it's slightly better, but our community case fatality rate is slightly higher than the province. Our day-over-day doubling time is better than the provincial of the province as well as Canada. And in this graph, as you know, if the doubling time is longer, that means it takes much longer for the case counts to double, and that means it's better. If the doubling time is lower, that means the cases are increasing at a rapid pace. So we can see in the blue line where Windsor-Essex is, we are doing much better than the province and Canada, but it is coming down. We were doing much better a couple of weeks ago, but this number is coming down, something that we need to be mindful of. Looking at our most recent estimated median R-naught, right now it is 1.07, and this has decreased from last week. Last week it was higher, and as we have explained before, when the R-naught is more than 1, that means the cases are increasing, and if it goes below 1, that means the cases are coming down in the region. So right now it's still on the upside, more than 1, and that means the cases are increasing. And with the report today, 70 cases, it is something that we should all be mindful of, that how quickly things can change. We were able to survive the impact that we have seen in November, December, and we truly hope that we can avoid that moving forward. Now some data on the vaccine, how we are doing the vaccine. So looking at our vaccine data, a total of 111,362 doses have been administered to 98,928 Windsor-Essex residents, as Teresa mentioned this morning, which is giving us a coverage of roughly 23% of the overall residents who have received at least 1 dose. And this particular slide gives you a breakdown of these doses administered over the time, and most second doses were administered in the month of February. And in March, with increased vaccine supply and changes to the dosing schedule, we have seen a dramatic increase in the first doses administered to our residents. And as you can see in this graph, there were days when we have vaccinated more than 4,000 people in the region, but more consistently, we have been vaccinating close to 2,000 or 2,500 to 3,000 people every day, which is a significant amount of vaccine administered every day with the supply that we are receiving. We receive roughly we are receiving roughly 10,000 doses in a week, and with the increase and decrease in the days of doses, we're trying our best to make sure that we are not keeping any of these vaccines longer than is needed. Looking at our overall cumulative doses administered in our region, our doses have skyrocketed since we opened up our mass vaccination clinics in March, when the supply increased from the province. And as you can see, as Teresa mentioned, hopefully by the end of the day today, we'll have more than 100,000 people vaccinated in Windsor-Essex, which is a big achievement on all our health system partners' part to ensure that we are vaccinating all the residents as quickly as possible. With respect to age breakdown and the coverage rate by age, we can see that 80 plus population, we have already covered. Our coverage is 88.1%, followed by the 70 to 79 age group, and so on. While you can see that the priority group continues to be 60 to 69, but from an age perspective, but all these other age groups belongs to the other priority groups, such as healthcare workers or other prioritized group in the region. Looking looking at our hotspots, so our hotspot, as we know, Windsor-Essex have identified 7 hotspots in the region, and the coverage rate, when we are comparing the hotspot coverage rate with the rest of the community, it is slightly high, but not significantly, and not at a level that would be concerning. So our overall coverage is 22.6%, and the hotspot coverage is 18%, and some of these hotspot postal code areas have actually exceeded what the average coverage rate is. So while there are some postal code that does require some attention with respect to vaccinating the people in those particular postal codes, but the majority of them are well aligned with the rest of the region, with some differences which would be expected given the demographics and given the some differences in various neighborhoods. So majority of the doses are administered with the hospital-based clinic that's in operation since the end of December, followed by the pharmacy. We've received our residents access the pharmacy significantly to get their doses, followed by the mass vaccination clinic and through other strategies in the region. With the type of vaccine that was administered to Windsor-Essex residents, the majority received the Pfizer-BioNTech, and then followed by AstraZeneca and Moderna vaccine that arrived in our area. And overall cumulative doses administered by the vaccine type, similar picture, Pfizer-BioNTech the highest, followed by followed by AstraZeneca and Moderna. Another way to look at it, that how each of these vaccines were administered by day, and since we participated in the pilot for the pharmacy program, that's when we are seeing a huge increase in the AstraZeneca doses in the yellow, but with respect to Pfizer, we continue to be at a steady rate given the supply of the vaccine coming down from the province. So in summary, the case rate in Windsor-Essex was higher for the most completed week. Acquisition sources distributed between close contact and community transmission. COVID-19 related hospitalization and ICU admissions have remained low in our region compared to the province, and vaccine rollout has picked up since the beginning of March with increased doses. Our overall vaccination coverage rate is 22.6%. Looking at our monitoring indicators, our most recent completed weekly case rate is 71.6 cases per 100,000 population, and then most recent 7-day rate is 72 cases per 100,000 population. Our percent positivity was increased compared to last week, 5.5% for the full week, but in just the last 7 days, it's 4.6%, with our R effective is 1.07. Thank you.
We'll now take questions from the media. Is there any questions from Blackburn?
I know we've always said that hospitalizations, ICUs are a lagging indicator. Do you think that's why we're not seeing the younger population in the hospital yet? I've heard a lot of things from across the province that people are getting sicker quicker. So why do you think we're not seeing those hospitalizations?
Great question, and I don't have an answer for that. It's a trend, and you're right. Sometimes it's a lagging indicator. Not everyone in the younger population will end up in hospitalized or in ICU, but so far we are not seeing the similar trend, and it could be some other differences that we probably don't have a better understanding. But and that's why I presented some of the breakdown of the data as well by age and the people who are hospitalized and in ICU. So hoping that we don't have to see that, it'll be really concerning for our community if we start to see similar trend with more hospitalization and more ICU.
And are you hopeful with the schools closed next week that maybe will help to break some chains of transmission as well, and that could further bring down our cases? That we're in lockdown, and then also for that week, kids won't be going to school.
That's the hope, and I think with as much as it is a concern every time when communities go into lockdown and stay-at-home order. It brings many challenges to everyone living in the community, but it helps to break the chain of transmission. So that's the hope, that we are seeing some ups and downs in our cases. So today 70 cases, it's a big concern. It's a big jump from where we were yesterday. And with the hope that if all these measures are followed by everyone in our community, we should be able to break the chain of transmission, and we can come out stronger when the stay-at-home order is lifted, and we can be much more ahead of many community in opening up.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Are you still scheduling appointments for vaccination for healthcare workers? I've been told that may have been paused at the moment.
So we do have a separate process for healthcare workers, and we are still vaccinating healthcare workers, but not at the rate we were doing before, because it's a separate process. So we are looking more at how to capture more healthcare workers that are remaining that require the vaccine. So it isn't paused, but we have to figure out a better way to get them vaccinated, how to book them and get them vaccinated.
I'm hearing from one person who they've been newly hired at a local hospital and they want the vaccine, but they don't seem to be able to register right now. Can you speak to that?
Well, if they're working at a hospital, they would be considered eligible for the vaccine. So they should talk to the hospital that they work at and try to arrange for the vaccine.
Okay, and then separately, have you heard any update from the Ministry of Health based on the province's announcement on Wednesday? Any further direction on executing any of those updates?
So the update that we are executing is the 50+ age group for those in the prioritized neighborhoods, postal codes. So that has started, and we're moving forward with that.
Okay, thank you.
Any questions from AM 800?
Teresa, just a response yesterday from the 50 and over. What was it like? We heard it was very busy. I believe the city said the phones were ringing off the hook. I guess, just do you have a number on how many people actually registered?
Oh, I don't have the number, but I know we are continuing to open up appointments as we, finalize schedules. I know there was some miscommunication because of the amount of calls being received. So that's why I wanted to provide clarity that those that are calling into the call center, whatever you see on the online booking, if you're able to book online, it's the same appointments are at both sites, whether you call or whether you go online. So calling at the call center, if you don't need to, doesn't give you access to different appointments. So just wanting to clarify that. But yes, everyone was really busy yesterday, and that is going, and today. We imagine that will continue on as well. We are booking the special educators that have been educator staff that are being allowed to receive their vaccines. So a couple things going on concurrently, and it probably has totally impacted the call center regarding the different groups that are trying to access an appointment.
Dr. Ahmed, just to go back to your summary for the week and the different slides, the one when it comes to the age groups, 20 to 29, 23% the last 2 weeks. I'm guessing the message is the same, but as we're hearing across the province, it's the lower age group that's getting the virus. I guess, what's your message to these individuals?
Well, I think we're seeing similar trend in our region with the cases increasing in that population group, and I can understand that there may be some questions about COVID fatigue. People don't want to follow those restrictions, but those are the important ones. And as we see that, especially in other parts of the province, those are the people who are now being impacted more they're coming in very sick, they need ICU care, and they are staying longer in the ICU. So that's a big concern for that age group as well. Many of them think that maybe they are not at a risk and they may not develop the same complication as most of the elderly people get. But this is not true, especially with some of these variants. And so it's really, really important for everyone to follow the recommendation, follow the public health guidelines, and keep themselves safe. We definitely don't want to see an ICU or hospital full of younger people staying as a result of COVID. So this is the time, we have the opportunity, we can turn this around. We just have to follow the guidelines. We have to make sure that we are keeping everyone safe.
You mentioned in the presentation the age group 60 to 69 for hospitalization. I might have misunderstood. Is that for ICUs, or that's just individuals going to the hospital and needing treatment at the hospital?
So this is the ICU admission and on individuals that we have the data. There may be some individuals who we may not have all the data. With respect to the hospitalization per se, it's distributed in various age group with no particular age group identified specifically. So I was focusing more on the ICU side, that who is in the ICU, and if we are seeing the similar trend with younger people in the ICU, which is not the case at this time.
Thank you.
Any questions from CTV?
Yes, good morning. Just to kind of expanding on Rob's questions, some people, I guess, would argue that if more older people are vaccinated, then of course more younger people are going to be the population with the new cases. So what is your, I guess, response to that argument?
Well, it's not a function of who or that we have to have a certain number of cases in the community. If older people were impacted more, that's great. But if the younger people were following some of those recommendations, if they were not seeing the spread, we should have seen similar number back in the same days. So what the data that I'm showing is, it's a comparison just between the same age group. So if you look at the graph where it shows ages between the 20 to 29, you can see overall since the beginning of this pandemic, they used to constitute most of the cases in that group. And then now they are the one that's leading many of these cases in the community. So I think if they follow the guidelines, they don't have to see the spread. They can see minimum transmission just like any other age group. But if that is increasing, that's where it prompts the action. And we want to make sure that they are also taking the precaution. They're not thinking that they are not at risk of contracting or not at a risk of developing more severe complications. They are. And this is what we are seeing across the province. And hopefully people take that as a motivation to follow the public health guidelines.
And do you have a breakdown of how many of the new COVID cases were people who were vaccinated with at least one dose?
It's not possible at this time. We have asked the province to do that at the provincial level to see what kind of a vaccine effectiveness data that can be calculated, and we're expecting that there may be a report coming from the province from their level. Locally, it'll be we have to go through a manual process of cross-referencing who is sick and then whether they get the vaccine or not. The data is not connected at this time. So there may be, it will come sometime in the future, but at this time it's not possible. But a provincial report should be coming out soon.
Okay. And can you talk about that milestone of reaching 100,000 people vaccinated in the community? I guess what does that mean, the significance and the timeline for how it was achieved?
So I'll start, and I don't know if Teresa wants to add that more on that milestone, but the way I see it, it is a pretty significant milestone. And again, you can look at it from two perspectives. Our population is roughly around 420,000 people in the region. So reaching a milestone of 100,000, it's pretty significant. That's almost like a quarter of our population. And on the same side, you also have to recognize that 16 years and younger are technically not eligible to receive any vaccine. So even if you include that, that numbers drops down to close to 320,000 population. And within that 320,000 population, that's 1/3 of our population that's vaccinated. So it's a pretty big achievement. and you cannot imagine how much work it went behind the scene, working with all our partners, working with all our staff that are diligently involved in the vaccine clinic and everything. I'll pass it on to Teresa to maybe just add more, but it is pretty significant for our community.
I would agree, it's very significant, it really is a testament to the commitment of our partners, the municipalities, the hospitals, Erie Shores Healthcare, Windsor Regional Hospital. They have been giving out vaccines for quite some time now. The EMS has been helping as well. So a lot of work has gone into achieving this and using all of our vaccines. So the monitoring of the vaccine and also taking the opportunity to be a pilot site has really helped us. As you can see with the AstraZeneca, the pharmacy rollout, that really increased our numbers of people that were able to access the vaccine significantly. So it's very good, and you know, in whatever, it's been 6 weeks, like in March, you could see where we really ramped up the vaccination efforts, and we hope to continue. So yeah, it's very, very good to see.
Great, thank you.
Any questions from CBC?
Yes, just to confirm, there is no plan to administer vaccinations for 18 plus in hotspots at all, or do you expect this will occur just sometime later than what's happening in Toronto and Peel?
So I am never going to say never, but today there are no plans to vaccinate 18 plus in any of the identified postal codes. The plan is 50 plus, and specifically the ministry calls that we've attended, the 18 plus have been very specific to Peel and to Toronto, where they have mass immunization clinics, but they want to reach certain neighborhoods, and they don't have access in those neighborhoods. So as I talked about before, we do have a mass immunization site right in one of the neighborhoods. We have free busing there through Transit Windsor, and also we're working with the Chamber of Commerce regarding any other transportation barriers. So we are in good shape today, 50 plus. If it changes, we will let you know, but no plans right now. And it would further our vaccine supply. I know I keep saying this, but our vaccine supply has not changed. Opening up to 18 plus, we're still using the 10 to 12,000 doses we're getting every week. And so it would further, you know, compromise the people that are targeted right now in their age groups.
Back in early March, the provincial government announced that the 13 hotspot health units were slated to receive, I think it was 920,000 extra vaccine doses between them. I know you've said that we haven't gotten more vaccine, but did we ever see changes to our allotment as a result of that announcement, or is that still to come or already factored into the current planning?
It probably is already factored into the planning, or maybe there will be more to come. I'm not really sure. I have been on meetings where it seems that it has already been factored in, and it also comes into some of the decisions about who can, you know, who would be better to receive vaccine through pilots. And as I said a couple of days ago, even the strategy on Peely Island, that didn't come from our allotment. The ministry provided the extra doses for Peely Island. So they have been very good with their vaccine supply when they can, but I think it's already incorporated into our regular supply.
Thank you.
Any further questions from Blackburn?
Yes, I have a few questions from a listener who is wondering about when people with developmental disabilities will be able to register for a vaccination, and about their essential care workers, many of whom aren't employed through an agency but are employed through, you know, independent as independent workers.
So right now, our process would be for people to work through their primary care providers, and a list of the patients that meet the criteria for highest medical conditions and high medical conditions would be provided, the physician would be sending that forward. And we have provided information through the Essex County Medical Society on how that is accomplished. And they can identify the patients, and if they know the caregivers, that would be better, that would be great as well. But that is happening right now.
Okay, thank you.
Any further questions from Windsor Star?
Yes. Is there any update on getting the vaccine into people's homes for housebound people who are currently eligible? I know I'd asked about this a while ago, and you said it's a challenge because with Pfizer and Moderna, they're not easy to transport. But do you have any update to that?
So we continue, it is on our radar, and we do know that we have to provide a mechanism for people that are in their homes to receive the vaccine. And we have heard that of at least one other health unit that has tried to use Moderna for this purpose. We have not used Moderna yet. We were waiting for either an AstraZeneca or a Johnson & Johnson, where it is not where the storage and the transport is more stable. But we will keep an eye on this. We will continue to investigate and see how the vaccine can be safely transported and who would be able to do that. We know that we have good partnership with EMS, but it really is around the vaccine. So we'll continue to work on that. And unfortunately, we're not quite ready, and all of this would be approved by Dr. Ahmed because it is a pretty big undertaking, and we want to make sure we have the right vaccine for the right purpose.
And to be clear, at this point, the health unit doesn't anticipate to receive any AstraZeneca or Johnson & Johnson in the near future.
So the AstraZeneca supply that we've been aware of is for the primary care providers and pharmacies. And even though we were part of a great pilot site where we got 25,000 doses, the new allotment for AstraZeneca is significantly reduced and is around 5,700 doses.
Okay, thank you.
Any further questions from AM 800?
Teresa, just going back to the milestone for a second here. I guess when the vaccination process started on the 1st of this year, did you and the team have a goal on when you would like to reach this number of 100,000?
No, there was never a goal. It was just whenever we got vaccine, we strategized and said, okay, how can we get it out? And as you know, we started with long-term care and retirement homes, another example of a pilot project which allowed us to get a little ahead of the province and actually really kind of define our processes and our efficiencies. And I think we've come a long way and have become more effective at delivering the vaccine. And at that time, as you know, we did not have the mass immunization sites up and running. And so not only have the doses been administered, but a lot of good plans have come to fruition in our community. And I can't stress enough, with the help of the municipalities, they have provided excellent sites in which to administer vaccines. And with our partners at Windsor Regional Hospital, who had the sportsplex and early on converted that into a vaccine site. So a lot of, good collaboration came together to achieve this so far. And the goal still with the province is to have people vaccinated in Ontario with first doses by the end of June. So we'll see how that goes, but the 100,000 is pretty significant for our area.
Thank you. And one final one for Dr. Ahmed. Dr. Ahmed, I'm noticing on the Public School Board's website more cases at Riverside High School. In the last 3 days, there's been 5 cases. Is it safe to say an outbreak hasn't been declared yet because those cases aren't linked together? Is that the right wording?
Yeah, when we are dismissing a cohort, it does require additional investigation, and a cohort can be dismissed even with one student coming back positive. We have to do further investigation. We have to see if there is any additional case that arise after the dismissal or at the time of the dismissal. So we haven't declared an outbreak yet, but that also means that some of these pieces are still being investigated, and an outbreak declaration will be made if we find any evidence of transmission in the school setting.
Thank you.
Any further questions from CTV?
No, thank you.
Any further questions from CBC?
No, thank you.
Thank you, everyone.
Thank you.